you're in the right place. Dr. Kris Wusterhausen has been in your shoes, and he's done the work and can show you how you can turn things around. In this podcast, he'll share his personal stories and advice on how to create the life you want for yourself as a provider and as a business person. You'll learn how to reclaim your life, your time, your energy, and most of all, reclaim the dream you had when you started your journey to become a doctor. Welcome to the Dr. Kris Podcast. All right, welcome back to our series with Dr. Kris of the Research Clinic, Dr. Kris Wusterhausen. He's, these conversations they're rooted in this journey that I think the folks that really enjoy this conversation, we're all coming from a place to where we evaluated ourselves at one point in time and decided, I need to step up, or I need to make a change, or I don't like the path I'm on. And what I like about talking with you, Dr. Kris, is of my experiences with the doctors that I visited. They're good people. They're doing the best they can. But I've just been disappointed in that I could never really get a conversation going with them about the things that are important to me about my health. I'm unique. I'm different. One size doesn't fit. Yeah, one size doesn't fit all. And it's like, you're this doctor that's actually more human. It seems like it kind of sounds absurd to say it, but it's true. Is it just bred out of you in the training and when you go to medical school and become a provider?
Well, one thing that we've never talked about is I think somewhat it actually goes back to our training, because I'm actually a DO, an osteopathic physician, versus an MD, a medical doctor, allopathic as they call it. And first of all, first thing I'm going to say is there's good and bad everything in every field. There's good and bad plumbers, good and bad AC guys. There's good and bad MDs, and there's good and bad DOs. And I'm really lucky because the number one osteopathic medical school that I went to is here in Fort Worth, Texas, which is 12 miles down the road. And so osteopathic physicians in my area are quite common. I've actually been asked, what is the difference, or what is an osteopathic physician, twice in my whole career. So here and where I'm at is kind of like the breeding ground of osteopathy, as we call it. And so I think that all of the patients actually kind of understand it. And at the end of the day, a DO and an MD have the exact same privileges and rights as a physician in the United States. Our training is just a little bit different. And so if anyone were to ever ask me what's the difference in osteopathic versus allopathic, DO versus MD, we're actually trained a little bit more in actually the musculoskeletal system. We're actually trained manipulation, which my DO brethren will hate this when I say this, but you can kind of call that like chiropractics. We think it's a little bit higher than that, but you can kind of think of it like that. We actually get many more hours of training at our medical school than allopathic physicians. But the biggest difference is that we believe in treating the problem or the root of the problem versus just treating the symptoms or the disease, which is what we always talk about. Now, so maybe that's where it started. Maybe. I think it just starts from my roots of being raised on a ranch and, my family and my friends and things like that. And I always think it's what every physician does, but as I've been told, it's maybe not what all physicians do. So there's nothing inherent in me that's just saying let's be like this. It's just happening. But going back to my osteopathic education, again, really trying to find, they have a saying prevention matters most, and so as a physician, we were taught from the start of prevention. But I will say that even gets lost today, though. When I was an osteopathic physician providing traditional family practice, I don't know that towards the middle and end of my traditional practice that I was any better at preventing anything than any other physician was. And it's kind of like what we talked about in our last podcast, just how the system is set up. Prevention's just not really built in, other than, hey, Steve, go get your colonoscopy at 50. And hey, we checked your cholesterol panel and your PSA once a year. And, here's what it showed. I mean, I'm being exaggerative, but that's about what the prevention model looks like. Did you get a chest x-ray? Did you get, and there's just so much more to it than that. And so, it's just, I think that most people make things way too complex. It's actually how I try to explain things. I will explain things to a doctor just as I would to a patient. Maybe that's just how I talk, but I always want anyone I talk to walk away with a general understanding of what they actually just heard. And one thing I have heard multiple times by my patients is could you explain what the doctor was trying to tell me? As a primary care physician, I would on a daily basis, multiple times a day, they would come back to my visit from the follow-up from the cardiologist, pulmonologist, or whomever, and asked me to explain what they said to them. And I'm like, what? You're like, you walked away from that visit. A, you didn't say anything that you didn't understand them. You just nodded your head and walked away, I guess, because they knew I would explain it to them. But B, shame on the physician for not explaining it in a way that the patient could actually understand it. And I've always just taken that to heart. I always tell my patients, if you walk away from this visit not understanding, it better be because you just didn't raise your hand, not because I did a poor job of explaining. So I guess it all just kind of runs together on how we do things. By the way, your dog just showed up.
Yeah. She's doing a cameo over there.
Yeah.
So you made a statement last time we were talking, and I thought, what a great statement. It's a bit of a confession, but if everyone is being honest, we've made this statement ourselves. But you said the other day, and I giggled when you said it, but I used to be a shitty doctor.
Mm-hmm.
Tell us why you said that. Where's that coming from? And how does that fit into where we're going with all these conversations?
Well, I mean, I think that obviously, or hopefully, I was being a little bit exaggerative, but it was what I felt like inside.
Mm-hmm.
I felt like I have more to offer to my patients than what I'm giving them. I feel like I'm giving them a third, or I don't know the percentage. I'm not giving them 100% of what I have to offer. And that was growing inside of me. Not only was I not giving to my patients what I have to offer, I wasn't giving to myself or my family what I had to offer.
Mm-hmm.
I was caught in a rut that I didn't know how to get out of. That rut felt 20 feet deep, and I'm only 5'10", and there was no way to crawl out. I didn't have a ladder. My health, as we talk about all the time, I wasn't happy when I looked in the mirror. I just wasn't happy with this person. I probably said it most podcasts, how the hell can I tell somebody or ask someone to make changes when I'm not making the changes myself? I mean, you've probably heard me say, I don't want to turn into that Norman Rockwell physician that's, portly with the glasses on the end of his nose and, that just looks like the absolute opposite of optimal health. That's not fair to me. That's not fair to my patients. I really subscribe to the model that I'm only as good to you as I am to myself. And if I am in bad shape, I'm not going to be able to provide the care for the length of time that I want to and provide the quality of care. Because if you do better, you feel better, you are better. And, that's just what we need to be. And I need to be an example for my patients. And that example sometimes is an example of failures as well, and admitting our failures. And, I do it all the time. Heck, you and I've had conversations. I don't mind admitting my failures. And hopefully my patients take that as, oh, he's not perfect either. Because, you see those trainers and heck, I've got one here and I love him to death, but they're in such great shape and they do a good job with their diet and we're envious, it's like, God, I want to look like that guy or girl. we always have to remember, first of all, they've got all day long to work out. That's an advantage. And that's all they have to concentrate on is their fitness and their eating, and good for them. I'm not knocking them for doing that. But even they fall off the wagon at times. They don't eat as well as they should. And they maybe have, to them, it's a huge deal. Maybe their body fat goes back 2%, which to us is no big deal, but to them it is. But even those people that we have on the pedestal of perfect eaters and things like that, well, they've got issues as well. They fight the same demons in battles. Movie stars, I forgot which movie star I saw a picture of the other day, and I was like, wow, they've gained like 20 pounds. Just because, yes, they've got more money and they're able to control some of these things by hiring a chef and a trainer to come force them to work out, but they still struggle with the same things that we all struggle with. And I just always want my patients to know I am in no way different than them. Maybe I have more knowledge on this that they do, and that's what I'm here to help you. But, my patients got tremendous knowledge and things I know nothing about. We all have our own little niches, and we all have our own trials and tribulations.
So you saw that the path that you were on wasn't going to where you had at one time envisioned yourself going, right? And so you admitted, hey, this is not going the right direction. I need to make a change. But there's a lot of scary barriers there.
Mm-hmm.
So you had to change your identity as Kris, the person, then Kris, the doctor, then you had to think of even your practice. But there's like 3 main changes that you had to start addressing.
Yeah, so many changes. And, and I think the one thing that I was a guy that went to high school, college, medical school residency. There was no breaks in any of those except for maybe a summer. Okay. Which I always had a job because my family, we couldn't afford, me just to take 3 months off. I always joke between college and medical school for 3 months, I mowed the local cemetery. That's what I did to survive because, who's going to hire a college graduate for like 2 months? The cemetery will. And that's what I did. And I'm appreciative of that because it created my work ethic. But when I went into, actually, and I would say it maybe even a different way, I don't know what I thought being a doctor was going to be like. We all have this thought of what it's going to be like. One thing today, if you get into medical school, you pretty much have to go volunteer in like doctors' offices and hospitals and things. And maybe kids today or young people today have a better idea of what medicine is like. I mean, I had no idea. I knew I loved science and I wanted to help people. And I started out wanting to be a veterinarian and realized that's way too damn hard for me, being out in the weather. And, I worked for a veterinarian in high school for 3 years and I was like, hell no, this is too hard for me, pulling calves at 2 a.m. And cause I was literally his assistant, like, this is hard work. At least a doctor gets to go in with like controlled temperatures and things like that. And I always joke, and my patients will be able to talk to me, which sometimes maybe that's not the positive. I'm like, at least the veterinarian, the patients don't talk, but, and that is a joke, but anyway. So I went into medicine, really, honestly, I'm not so sure I knew what it was going to be like, but what I did realize is that very quickly, it wasn't going to be for me long term. I took everything home. I took everything to heart. And I still do, but it was just too much. You have to admit, that maybe this job or maybe it's a marriage or something like that. Maybe this just isn't for me. And I'm going to be better off for that person or people and myself if I change something. And that's just where I got. And I got lucky enough that my own health problems occurred. And because if I don't think if those things had occurred, I'd probably still be there, because what happened is I've had issues that I didn't know what to do. I didn't have the training in medical school to react to it. And that's what caused me to start getting other training. And that's when I saw this other side of medicine, this cash pay model, this wellness model that I got exposed to. And I started dabbling in it part-time, working under Dr. Thompson, one of my great mentors. And I saw there was another way to do things. And I saw I'm not going to lie, I saw their their way of life, their how his life was after hours and things like that. And I was like, the shape that all these physicians were able to be in because they had the time to dedicate to themselves. And I said, I really think this is for me. And my transition has been slower than maybe I would even recommend for others, but every situation is different. I think there's no doubt that I'm a better doctor today than I was 10 years ago. I believe I'm in healthier shape today than I was not even 10 years ago. It was 15 years ago. Now that I always say 10 years, it was 15 years ago, going on 16 years ago. I don't regret it for a second. I've learned so many things. Oh, and the other thing I was going to say is, so the reason I was saying that high school, college, medical school, residency, practice, I didn't know a damn thing about business. They don't teach doctors business. I truly wish if I could had a way to change medical school, it'd be have doctors take a business class, each semester, even if it's for an hour a week. Just we got right before we graduated, 1 week before we graduated, and guess how much we really cared about that class. Okay. We've already done everything. We're ready to graduate. We had a guy come in and talk for 1 hour on contracts. None of us cared because we were going to residency. There's no contract in residency. So it's like 3 years from now, by the way, this might be useful for 1 hour. That was just like our nutrition training. I always tell you was 1 hour, the food pyramid. So I didn't know anything about business. I made horrible mistakes. I still make mistakes. Any businessman that says they don't, or woman that says they don't make mistakes is lying their ass off. I've gotten better. I think I'm better at business. But those are things as a physician that we just don't know. Luckily I've got really good patients that I lean on my patients a lot of times for business decisions, that they're not, because most of these are non-medical decisions. They're business decisions. And so, you lean on those people that have that knowledge base. But anyway, yeah, there's a lot of things to go into it, and it's scary as hell. Because you've built something and you're like, like we talked about last week, and you're afraid that if I move away from this model, and even for 3 months, 6 months, and if it fails and I try to go back, has that model disassembled? All that work I did over the last 5 years, 10 years, 15 years, is it gone? So those are all things that providers, making these decisions can be quite difficult.
So this change has helped you kind of gave you a way to step out of the, I'll say, the insurance influenced business model. But it's like you were able to start considering other options, maybe options you didn't know existed. And when I say options you didn't know, I'm relating as a patient. In the same way, you entered a model that there are options that you could follow and employ that you didn't know. There were treatments and ways to help your patients be more healthy on options they didn't know, because you took the chance. Mm-hmm. You crossed that bridge or that chasm.
Mm-hmm. Not only that, but my enthusiasm for medicine returns.
Wow.
As we talk about now, I don't want to say every physician's like this, but I think I'm right when I say the majority of physicians are like this. You get in a rut, you prescribe the same handful of medications that you prescribe, you treat kind of the same conditions over and over. And I think you, at some point, stop learning with the same amount of vigor that you did when you were in medical school and residency, because you're like, oh my God, I did that so much. And there's going to be some physicians that do a really good job of reading every current journal and these things and staying current. I don't know how you pull that off in the traditional model of working as you work with the hours that you work. And then are you going to go home now and read for 2 hours, 2 or 3 times a week? I just find it to be ineffective long-term. And I guess what I'm trying to say is you get stagnant in your practice. Whereas now, we travel all the time, either giving lectures or going to lectures or both. And I'm always learning. I mean, I am amazed. Like I am reading and training right now under Dr. Dayan Goodenow about all these new amazing progresses that has been made with dementia and Alzheimer's disease specifically, but yet no one knows about it. I say no one, mainstream doesn't know about it. Why do they not know about it? Because the things that this doctor has found and prescribed, you can't buy at Walgreens. You know, and unless it comes from Walgreens or CVS, traditional medicine doesn't care. And what I mean by that, what I'm really saying is if Pfizer or Merck or AstraZeneca or Bristol Myers Squibb doesn't make these cures or these treatments, they just don't get to the physician because most of their knowledge base comes from that drug rep that walks into their office once a week and gives them their 2-minute blurb about whatever. Even drug rep dinners don't really occur anymore. We used to have drug rep dinners all the time, and they don't really occur that much anymore. So really where most doctors get their knowledge base is from the drug representatives of these Pfizer, Merck, AstraZeneca, Bristol Myers Squibbs of the world. And they're not out there learning about all of these other things that exist, but they don't exist in that model. And so I just think that that's what's really been what's the word I'm looking for? What is giving me the enthusiasm back towards medicine, knowing that, yes, some of these treatments are expensive. Yes, most of these treatments cost cash money, but they work. They're there. They're safer than the alternatives that can be. Again, I'm not saying let's not use traditional medicine. I'm not even saying that for a second. But what I am saying is that let's find out what's wrong with these patients and maybe there's a treatment that's right for them. Let's not just throw our demented patients on Aricept and Namenda and I know your history with your close friend that had dementia. Those medications don't do, I'm going to be nice and say they don't do much. Okay. Some might say they don't do crap. Okay. But they don't do much. And there are things out there that we can do, the cytox testing, and I'm just picking on dementia because it's, something that I really want to start focusing even more on in my practice. Everybody's touched by dementia. But we can do that with diabetes, high blood pressure. We have, there's just so many ways to treat our patients. I had one of my great cardiologists text me yesterday, an article that he just read about how even with slight elevations of your A1C, which is your 90-day blood sugar test, even in normal range, but slightly high normal range actually puts you at higher risk now for heart disease. And his point was he was very kindly actually giving me a pat on the back, basically saying, this is more evidence that you harping on people about their blood sugar control is so important. Whereas most doctors, providers only worry about blood sugars when you're diabetic. Like, oh, sorry, Steve, you're now diabetic. And that's horrible. But even just elevated matters. We know that if you have even slightly elevated blood sugars, you're knocking days and weeks and months and years off the end of your life. This thought that we have to let things become a disease before we treat them has to be stopped in America. If we just wait until, all right, Steve, now we're going to get busy because you now have diabetes, when we knew for frickin' 5 years you had elevated above normal blood sugars, but we chose to ignore it because the doctor was too busy or the patient didn't care, or they just maybe no one just talked about it. I don't know. But those are things that you can do differently in medicine. And I think if a provider really is attracted to that model, they need to look at this model. This is not going anywhere. It's the fastest growing field of medicine at the moment. There's only going to be more and more patients that want control of their lives, especially with the blogging and vlogging and all these things gaining steam. And all of our podcasting gurus that are out there, by the way, most of them aren't doctors. They're biohackers, which I love biohackers. I'm not against them. I'm with them, giving out information, some great information, some maybe not so much, but this field is not going anywhere anytime soon.
It makes me think about, the trends that are in place. If we're approaching as a provider that you have a business, and are responsible to run that business properly, you would want to pay attention to the trends that are happening in your industry. So trends of people wanting to know other options about their health, trends of what's going on in the medicine. You were talking about Pfizer and Bristol Myers and these guys. I was reading an article where they have slowed down trying to find new drugs because it's less and less profitable. And they're focusing more on vaccines because vaccines are like easy wins. They're not regulated like drugs. And so they're not motivated to look for new drugs. And so that's a trend that's happening. There's just a lot of things changing about how people research, how people want to eat. There's a lot of things going on that would be, hey, I need to get ahead of this curve, or maybe ought to position myself to where I can excel for the next 5 or 10 years.
Yeah, you're very right. You know, you either get with the trend, or the trend's going to leave you behind. And I hadn't really thought of it that way, but patients have more knowledge at their fingertips, literally, than they ever have. And not only the internet, but with all the podcasts and all these things that we can get constant information, and a lot of it very good information, versus the old days we'd be like, where the hell did you read that? And certainly some of that stuff is still out there, but many times, heck, sometimes patients come in and I go, that's interesting. I never thought about that. Let me go back and look at that and get back with you. Heck, I got a folder sitting over here, a patient dropped off, that I'm going to look through. I don't know everything. I'm open to everyone's thoughts. I always say, as long as I feel like it's safe, we can try it. That's where I do draw the line if I don't feel like safety is there. But our patients are very well educated these days. Now, there's patients that choose to just come in and basically, doc, you tell me what to do. That's not my preferred patient. I like educated discussions between patient and provider. I think we accomplish more by doing that. The patient's more bought in from second one, because they've done their own research and they want to get better. But yeah, I mean, if you try to just stick in that rut that I was in, you're going to get covered up eventually. That the patients are just getting smarter and understanding more, and that's why I feel like the field of age management medicine is growing so fast, because they realize they just can't get what they need in the traditional model. I mean, let's put it bluntly. If the traditional model worked, the cash pay model would be extinct. It wouldn't work. People wouldn't do it. People wouldn't go pay out of their pocket to go see a doctor when they have insurance if the traditional model worked. There's a reason why even in my little town, with tons of doctors around me that take all the insurances, and most of my patients are not uninsured, they're insured patients that choose to still pay out of their pocket to see me, because they realize they're not getting what they need. They keep the insurance. They have sometimes a primary care physician for emergency needs, like, oh my God, my appendix ruptured and I need it taken out. I've got United Healthcare for that. So patients understand it. They see it. It's not for everyone. As I always say, I understand that not every single citizen of my county is going to want our services, and that's perfectly fine. We wouldn't be able to take care of them if everybody wanted it. So it is more of an exclusive thing, but I think patients that see the value in it really feel like they get their money's worth.
If we were to be honest about traditional insurance and medication, this is what the future holds for that. Your insurance is going to cover less and less. Your physician is going to have less options to treat you. And so it's really turning into more of a triage situation. Just what managed decline of your health, that would be a good term. Am I being wrong?
So I had an older physician. I think he was actually my age when he joined me, because I was like early 30s and he was like 50. So I'm calling him an older physician. So I guess now I'm the older physician. But many years ago, he joined my practice here in town I actually worked for the county, and he was opening his own practice down the road. And we were, at that time, we're a provider down, and he joined us for like 6 months while this building was being built. And he had a statement about what we did, and it's always stuck with me. And he said, it's a glorified MASH unit, is what we did. It was high acuity patch them up, stick a Band-Aid on them. I'm being exaggerative, but patch them up to fight another day. And that's what we did. That's what we do. That's what traditional medicine many times is. It's a glorified MASH unit. So it's a triage unit, like, okay, you'll live for another few hours, go to that line. Oh crap, you're life threatening, come down this line. And here's what we're going to do. And I think many ways it's a very simplistic way to look at it, but it is what the traditional model is. It's a Band-Aid on top of a Band-Aid on top of a Band-Aid until the wound blows and the Band-Aid won't hold it anymore and you die. Or you need a bypass surgery or something like that. Whereas maybe we could have avoided all of that. And one of the big selling points I always tell my patients is I believe with what we do, we're going to cause you to work deeper into your life. You're going to want to do it because you're going to feel good. You're going to look better. You're going to feel better. Your quality of life is going to be so much better. Isn't that worth spending some money on yourself? And I think when you put it like that, and if you truly believe what I'm saying is real, then you're like, hell yeah, it is worth me spending, $2,000, $3,000, $4,000, $5,000 a year on myself. I'm not even throwing out numbers, but whatever the number is, $10,000 a year. Is that worth it spending on yourself if you're going to be healthier, better, live longer? Hopefully, I always say I don't give guarantees of living longer. It's all quality that we talk about. We want you to live better. I believe longevity comes with living better. To where maybe, because I don't personally want to retire. I that's never even been in my thought of retiring one day. I hope I literally work until I die. But I hope it's working as I want to work and being healthy the whole time with a sound mind. I mean, I don't want to say, oh yeah, Dr. Kris finally had to retire. He lost his mind, he couldn't remember anything. And oh my God, that's horrible. I'd rather be pushed off in a lake, to be honest with you. Dementia scares the absolute hell out of me. I fear dementia more than I fear cancer, to be perfectly, because at least cancer, I've got a fighting shot, I do now believe we have a fighting shot against dementia, but I guess I was going back to my previous thoughts of the traditional route of you get dementia and it's over, end of the line. How quickly is it going to do this?
I think about that as well. I think everybody does in some way or fashion. And I think what made sense to me when I started learning about this age management process is that if you start with the cell, the health of the cell, then you're addressing many of the root causes that would affect dementia, heart disease, sexual performance, all these things. It begins inside of that little bitty cell.
Yes. Yes. And what I always say is every disease goes back to cellular dysfunction. Name me a disease, I'm going to say yes. Okay. Ovarian cancer. Yes. Alzheimer's. Yes. High blood pressure, diabetes. Yes. Now, but the dysfunction can happen anywhere in the body. And that maybe comes into genetic applications or epigenetic, so that's where like our environmental factors that work on our, because we have genetics and we have good genetics, bad genetics. We all do. We all have predispositions to this, that, and the other. That doesn't mean because you have a predisposition to something, you're going to get it. But if you get certain environmental insults that can exacerbate those genetic malformations or whatever, then you can end up with that disease more likely than maybe I would. And I believe that's why, cellular dysfunction occurs and then that person gets dementia, but the next person gets Alzheimer's disease or Alzheimer's disease to like cancer. It's all because of these genetic predispositions along with epigenetic influences. And the great thing is we can't control genetics, but we can control epigenetic influences, especially as we get more like Alzheimer's disease. Now that we have some good tests that we could run to say, yeah, you are predisposed. Okay, we need to work on these things. But also just going back to, balancing, doing everything we can to control cellular senescence, which we've talked about is the abnormal cells and zombie-like cells that aren't doing their job properly. If we control cellular senescence, we ultimately improve existing diseases, but also are preventing potential diseases down the road. It's a very simplistic thought because it is simplistic. It doesn't need to be made complicated. If our 30 to 50 trillion cells are functioning better, guess what? The body does better and we have less chance of disease. So, it's just common sense. I don't think that even a doctor should make that complicated.
Yeah. So when you're talking that, we're moving from reactive to proactive. And so I always like to look at things like, what's the biggest lever I can lean on? And if I'm in a proactive state, that will ripple out through the organism or the organization or whatever,
Mhm.
and begin to make the most improvements with the least amount of effort. And that's what really clicked for me, was a cellular thought, this understanding that certain things that you eat, activities, drink, whatever, impacts the health of the cell. But it's like little changes in there can ripple out and make big changes all around your health.
And is it kind of like that in life? Sometimes the things that work that are the most positive influences are small changes. Most of the time it's not this huge change we made. It's these, I made these two or three little tweaks in my business. And oh my God, a year and a half later, it paid these dividends, versus I came in and fired everybody and started over. I made these few little changes and, wow, down the road, they made these differences. And that's the one thing that, Dr. Seeds is training with me, heck, Dr. Thompson, all of my mentors that I've had in my career, too many to even name. You learn all these different little tricks, and they're not for everybody. Like I say, I can't even do all the little hacks and tricks that I know about because I got to work. If I literally, like I had a patient in the other day. She wants to lose weight, and one of her husband comes here. He sent her to me, and I went down like, hey, I want you to do this, 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 and this. And I got to the end of this list, and I go, okay, you know what? I just gave you way too much stuff. Let's scratch half of this today. And she's like, no, I think I can do it. And I'm like, let's stick with these 5 things. Let's do this for a month. And then we'll come back and we'll start working on some more, because even in my brain, I'm like, oh yeah, let's do this and this and this. And, most of us will only do so many things at a time. And, things I try to tell new providers in this is, I know it sounds simplistic. I know just trying to talk them into doing some sodium bicarb every day seems simplistic, or maybe taking those ketone esters twice a day. I know this sounds really simplistic, but if we can get them to do it and do it for 6 to 12 months, they're going to see the benefits of this. But we got to get out of this mindset that if I do something today, I have to see the results within a week or I'm giving up. I can't help those patients. I can't. I tell them, if that's your mindset. Now, sometimes I'll give them little tricks that I know will show dividends in 2 to 4 weeks, just to maybe hook them a little bit more. But I'm very clear up front, hey, look, this is going to be like a 2-year journey. And if you're not up for a 2-year journey, because guess what? You didn't get in this spot overnight. You got in this spot over the last 10 years. And we're not going to pull you out of it. You're going to see differences. You're going to feel better. You're going to look better in 6 months. But before I probably get off your butt, it's probably going to be 2 years. And if you're okay with that, let's move forward. And you know what? If you're not okay with it, I always tell them, we'll part friends. It's okay. We can see each other at the football game and still shake hands and talk. It's okay. I realize I'm not for everybody. My program's not for everybody. Not everybody really wants to change. That's the one thing I've learned, is that some people, they talk a good talk, but they're not really wanting to do it. And so I'm okay with that,
I think that kind of brings us around a full circle when your declaration that I was a shitty doctor at one time, or you're feeling that, but there were little changes that you started to implement.
Mm-hmm.
And I think that's what we ought to discuss on the next on our next conversation, is like, let's talk about the little changes you made as a doctor,
Mm-hmm.
as a businessman, and then personally. And I think that would be a great discussion.
Awesome.
All right, perfect. So Dr. Kris of the Research Clinic, you can learn more about Dr. Kris and his practice at theresearchclinic.com. Dr. Kris Wusterhausen. I'm Steve Brown, your co-host. This has been an excellent conversation, Dr. Kris. I'm excited about this series of conversations.
Well, thank you for your time as usual. I appreciate it.
All right, and that's a wrap. Thanks for joining the Dr. Kris podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris podcast.